Joining us right now is New Hampshire Democrat Senator Jean Shaheen. She has been one of the lead negotiators for the Democrats during the shutdown. And Senator, thank you for being with us this morning.
Nice to be with you. Let me just correct you, though. I'm not a lead negotiator because there are no official negotiations going on between Democrats and Republicans, between the White House, between the leadership, between Congress. All of the discussions are member to member based on concerns about how do we provide health care for the millions of Americans who are going to see their prices rise dramatically and those who are going to lose their health insurance, and keep the government open. And that's my goal, is to see how we can do both.
Have you been having conversations with some of your Republican counterparts? Because people have looked at you as somebody who has signaled that with your vote last week to push the defense bill ahead. People thought that was a signal from you that you'd be somebody who would be open to negotiations. Who are you talking to?
Well, I'm talking to a number of my colleagues on the Republican side. I don't want to get into personalities, but I've had good discussions. I think there's a lot of intent on both sides of the aisle to address the problem, because people understand that 76% of the people who are recipients of those tax credits to help them afford their health insurance are people who live in states that President Trump won during the election. 57% of them are in congressional districts that are Republican. So our colleagues on both sides of the aisle understand this is an issue that we need to address.
It's hard from the outside to see how this breaks, how there is movement. From the inside, do you see a path?
Well, I think there are lots of options that we ought to be able to agree to, and it's a matter of a commitment. But again, I think what would help a lot is if the leaders of both the majority and the minority in both houses and the president would sit down and would solve this problem, because there are a number of different ways to do it that can address both providing affordable health insurance and making sure we keep the government open. And we should be doing that. And I'm disappointed that the president is headed off out of the country again without being willing to sit down and meet with people.
I guess Republicans, Senator, just say that they want to do both. They're two totally unrelated things. We had Senator Ron Johnson, on yesterday, and he was imploring individuals like you. You're not running for re-election. You don't need to listen to whatever it is Chuck Schumer, minority leader, is saying. You, like Senator Fetterman, you're in a position where you could, look at what's happening. And in the past, I'm sure you made comments about shutting down the government. Should never happen to try to blackmail another party into doing something. And he was imploring that you are going to lead the way, maybe be the next one to break away from, the monolith of Democrats that aren't supporting this. And then I think he mentioned, or at least someone mentioned, that you did vote for a bill that sort of indicated, the defense bill, that indicated maybe you were, I don't know, opening or at least weakening a little on your resolve to keep voting no. You've done that 10 times on a continuing resolution that's been voted on 13 times before to pass by Democrats.
Well, I don't think this is about what Senator Schumer says or what Senator Thune says. I think this is about how are we going to ensure that the millions of Americans who need health insurance because they can't feel secure in their lives without knowing they can get health care are addressed. President Trump is willing to spend $20 billion to bail out his friends in Argentina, but he's willing to let over 20 million Americans see their insurance costs rise almost double. So I think this is about how we work together to ensure that the issues that are facing Americans are addressed. And health care is critical. I had a meeting with some constituents last Friday when I was in New Hampshire. One was a man who was probably in his early 50s. He was a small business owner. He had had cancer. He got his insurance through the marketplace. He said, if I didn't have that insurance through the Affordable Care Act, I would not have gone to the doctor. I would not have gotten my cancer treated, and I would be dead by now. So he was talking about how important it is to be able to continue to afford his health
Right,
insurance.
but
That's what this fight is about.
Okay, but so if there comes a time when Democrats are back in charge and the Republicans don't like that and don't like something that your party does, you would urge them to shut down the government. You think this is, at this point, it's
No,
fair
and in
game?
fact, over the last 4 years during the
It's been
Biden
done-
administration,
but it's been
there
done
was
now.
no government shutdown. And there was no government shutdown because people sat down and negotiated.
But from here on out,
because we
it's
knew there were
okay.
issues that the majority, that the
You wouldn't
Republican Party faced
Right.
that we
Then you
needed
would
to
not
address.
criticize
And I
if
think we
Republicans-
need to negotiate now
Okay.
to address the issues that we
Right.
have, because in order to move this forward in the Senate, it takes Democratic votes. And so we need to be part of those discussions.
So you will not criticize Republicans in the future if they shut down the government because they don't like something Democrats
Listen,
are doing?
I've been critical of both Democrats and Republicans in these fights, and I will continue to try and call it like I see it. I think this is an issue where everybody should come to the table, and both sides have been at fault.
Senator, the pressure continues to ramp up. Not only do we have federal employees who aren't being paid, even essential employees who are being asked to come in to work, like the air traffic control. At this point, it's also being noted by many states that money for SNAP, the food benefits package for many Americans, more than 40 million, I think, get some assistance on this. That money is set to run out in most states at the beginning of November. When is there a pressure point that you say this is too much? There's too much other pain that's taking place on ordinary citizens in order to continue to keep the government closed while we negotiate this?
Well, again, that's why I think it's important to come to the table. I am worried about the people in New Hampshire who are going to see their SNAP benefits run out at the end of the month. I'm worried about the people who are receiving WIC food, the mothers and children. And I think we need to, again, encourage our leaders on both sides of the aisle to come to the table and address this issue.
We just had the CEO of Kalshi, the prediction market, on. At this point, they are assuming that it's going to be 42 days that the government stays closed. Does that sound right to you? Does that sound like a tenable situation?
I don't think it's tenable. I didn't think it was tenable on day one, but I think they're guessing. I don't have any idea. They're assuming that nobody's ever going to talk to each other. I hope that's not the case. I think one of the things that I hear from my constituents consistently is, why don't you all sit down and work together to address the challenges that are facing this country? That's what we need. We need to get people out of their partisan positions and to the table to work together to solve this problem.
And you just don't feel that if you open the government and do it through appropriations, you just don't feel that that could be done. It has to be done this way.
Well, I think getting back to appropriations bills is really important, and that's why I voted for the defense bill last week.
Mm-hmm. You also have plans to be introducing several bills today regarding sanctions against Russia. What are those bills, and what's the likelihood anything gets done before things kind of reopen?
Well, those are bills that have already been introduced. We have a business meeting in the Foreign Relations Committee today, and we will take up bills addressing Russia's unprovoked war in Ukraine for the first time in this Congress. And I'm really excited because I think these three bills are going to pass. One would designate Russia as a state sponsor of terrorism because of the way they have kidnapped Ukrainian children and taken them to Russia. It has bipartisan support. One is a bill that would address China's continued funding of Russia's war machine. Again, that has bipartisan support. Senator Cornyn and I are co-sponsoring that legislation. And the third would address the repossessed assets that we are currently holding from Russia and allow us to use some of those dollars to give back to Ukraine so they can continue to fight this war against Russia. Winter's coming. We know they need long-range missiles. We know they need help with their electricity grid because it's going to be a cold winter. So we need to do everything possible to support them, and that's what these three bills are going to help do.
Senator Shaheen, thank you for